First of all, the purpose of a fertility assessment is really to give women some gauge or idea of their egg quality and really how quickly their eggs are aging relative to their chronologic age. So we envision this as being helpful for women, particularly in their 20s or 30s, that might be unmarried or not ready to have a baby, but wondering how long do they have? Should they run out and freeze their eggs? Do they have plenty of time? And so we really do that with two simple methods: an ultrasound, where we can count the number of eggs in the ovary. We essentially count follicles, which are little sacs of fluid that have the eggs in them. And the more follicles in the ovary at any one time, the more eggs the woman has in reserve, and the better her future potential for fertility would be. And then those follicles give off a hormone called AMH, anti-Mullerian hormone. So the more AMH in the blood, the better, the more eggs they have. Kind of another way to look at the same thing. And then the third thing we look at is FSH, follicle stimulating hormone, is a hormone the pituitary or the brain makes. It goes down to the ovary. It sort of yells at those eggs to grow. And if their FSH is high, that's not so good. That means they're kind of yelling and screaming at the eggs just to get one to grow, which would be of concern. If their FSH is low, they're just whispering at the eggs, and one's taken off every month and growing, suggesting good egg quality. So FSH, kind of looking at quality, and then both AMH, another blood test, and an ultrasound gives them a quantity measure. And then we can regroup with that patient and say, here's how your eggs are at age 30 or 35 or what have you, compared to the average 30 or 35-year-old. Here's how long you could still likely be fertile, and you can plan your family accordingly. Or if it looks like time is becoming crucial, perhaps increasing your options by doing something like egg freezing would make sense.